doesn't have to be abuse, but many people have experienced trauma, and it helps to be mindful of that when, we interact with other people. This topic that I'm talking about today, it is a little bit sensitive, potentially triggering. So just gonna throw that out there in advance, for anybody that's listening. But it's important that we know, how to interact with people, how to spot the signs that someone may be struggling. So we're going to focus a lot on that. So I know she mentioned I work for the Morris County Sexual Assault Center. And at the end, I'll talk a little bit more about our services, but we serve people who are residents of Morris County, ages 13 and up. All our services are free and confidential. So it doesn't matter, if someone has insurance or not, what their immigration status is, we'll be able to serve them as long as they're a Morris County resident with a history of sexual violence. And today, the things we're going to talk about, I'm going to focus on college age students because they're a very high risk population. I know I just mentioned between the ages of 16 and 24 is actually the highest rates of both being a victim and a perpetrator of sexual violence. I'm also going to be talking about a specific type of PTSD called rape trauma syndrome, and other forms of PTSD, acute stress, things that happen after a traumatic incident involving sexual violence. I'll talk about the sexual assault response team, which is a multidisciplinary team of individuals that will help and respond to someone when they've been assaulted. And also talk a little bit about, re-victimization, resources available, how people are treated for sexual trauma. So, the legal definition of sexual assault is, rape is a social term. So in the state of New Jersey, the legal definition, any sort of vaginal, oral, or anal sex without the victim's consent. Consent is a tricky thing. When it comes to things like, drugs and alcohol, which happens a lot, with college age students. They, go to parties, maybe they've had a few drinks, and, it's very common for people to engage in sexual activity. But I think it's important for, people to know that, that they're not able to consent if they're impaired by drugs or alcohol. So whenever I teach this to students, high school students, even as young as middle school age, schools have asked me to come in and talk about drug facilitated assault. A person is not able to consent under those circumstances. And, when it comes to penetration, it doesn't have to be a penis, a organ, it's any sort of object. It could be a hand, a finger. So, any sort of penetration would classify as a sexual assault. And sexual assault in general, sexual violence, when I talk about that, there are many different things that fall under the umbrella of sexual violence. It could be, not just a sexual assault, but any form of non-consensual touching. It could be, cyber stalking, sending people images and videos of explicit things that they don't want to receive. It could be, even severe harassment. So those are all things that fall under sexual violence and, could be equally traumatic to an individual. Every person has their own level of resiliency, and, something could seem like a lesser offense and still cause the same amount of trauma as someone who experienced a very, violent rape that, resulted in injuries. So the trauma, it doesn't discriminate. A traumatic event can have the same impact, it has different impacts on everybody, but it could be equally as damaging. So the numbers when it comes to sexual violence are pretty huge. I really don't like statistics because the reality is most people don't report So I think these numbers are probably higher, but they estimate about 1 in 3 women and 1 of 6 men have experienced some form of sexual violence in their lifetime. That includes all the different things that I've talked about. Uh, about 1 in 4 college women have either been sexually assaulted or suffered an attempted sexual assault. And what they mean by that is during their college experience, this happening. A lot of people coming into college have already experienced sexual violence, whether it was childhood abuse, whether it was, dating partner abuse. A lot of people have already experienced this. But while people are, in college, they're at a higher risk of sexual violence. So I know I mentioned before, I was just checking the chat, that, people ages 16 to 24 are at the highest risk of not just experiencing, but also perpetrating a sexual assault. So if you guys can just use the chat and take a wild guess to see, what you think of this. So a survey of over 6,000 college students found that 54% of the women surveyed had been the victims of some form of assault. So what percentage of rapes in general were reported to authorities? So 1 is less than 30, 2 approximately 47, 3 approximately 65, sorry.
So we have a lot of ones. I should have enabled the poll. Next time I'll do that.
All right, well, you guys are right on the money. So less than 30% of all rapes are reported to authorities of any kind. A lot of people in college, instead of going right to the police, they'll report through their school. That's what the Title IX committee is for. And, the different numbers that I get, they usually say between 23 and like 32% of sexual assaults are actually ever reported. It is the most underreported crime. So many never get reported at all. Sometimes people never talk about it to anybody. And, it says arrests are only made in 30% of the cases. So 30% of the, less than 30 that are even being reported. And of those people that are actually arrested, only 2.5 are ever convicted. So, these numbers are really dismal as far as, a crime is concerned. These people have committed a crime, and, highly unlikely that it'll ever result in any sort of legal punishment. So, it's kind of sad. And like I said before, I don't like talking about statistics because we really don't know, these numbers are based on people that are polled. So this one is pretty interesting, and I'll talk a little bit about this study in a minute. But if you were to guess, so in a survey of more than 2,000 college men, what percentage said that they would commit rape if they thought they could get away with it? So 1 is 27, 2 is 35, and 3 is 54%.
We have a bunch of 2s, 35%. So far, only 2s.
Well, the 2s have it. You guys are good. So about 35% of college men in this survey admitted they would commit rape if they could get away with it. And, I remember in this particular study, when it came to, they also asked about, perpetrating rape. So it says 84% of men who committed rape did not label it as rape. So they asked various questions that described rape in certain situations, but the men may have admitted to doing it, but they didn't realize that it was rape. And I don't know if that's, denial, lack of education, but, they didn't realize that using this coercive behavior, aggressive behavior, a woman says no, but they continue to pressure them. Maybe they were very intoxicated and they continue to have sex with them anyway. These are things that we would consider rape, but they may not have even realized. And, a lot of the rapes that occur on college campuses are, repeat perpetrators, people that commit multiple rapes, and maybe they are sociopaths, maybe they just don't realize it. A lot of it can tie into the whole, rape culture, with the drugs, alcohol, pressure, trying to coerce people. It is, really sad, but a lot of these are perpetrated by the same people. And I just want to make a note, before we go into everything else, that I don't really like the whole, gendered approach of all these surveys, because this isn't something that just impacts women, and men are not the only perpetrators. This is someone that impacts everybody. Statistically, more men are perpetrators and more women are victims, but it definitely goes both ways. And one interesting thing about the college demographic, so, we're talking about the age range where you're more likely to experience sexual violence. So it's actually college, students that are men are more likely to experience sexual violence than men that age that are not college students. And it's actually the other way around for women. So women that are of that age range that are not college students are actually more likely to experience sexual violence. So, we I don't like using this whole gendered approach to talking about it, because it does affect everybody.
What happened to you today? Huh? What happened to
So
Kelly?
the reason that sexual assault can be overlooked is, different reasons. Some people are just
Kelly, come
not
sit down.
adequately trained to deal with it. Some people are really uncomfortable with either talking about it, approaching a person, or just the issue in general. I know specifically with my job, sometimes I'll tell people even what I do for a living, and it's like, oh, I don't know how you do that. Or, I'll recommend like, hey, I can come into your school and do a training. And people are like, yeah, like, I don't know if our school wants to touch that issue. So, a lot of people are uncomfortable with even talking about sexual violence. Now, when it comes to biases, we all have our own biases. We might not recognize them, but, personal, religious, and cultural biases definitely impact the way that people view sexual assault. There are cultures outside of America that, don't even view sexual violence as a crime. Or, perhaps there's a lot of inequality between genders, and they, don't view sexual violence as something that is wrong. So, like I said, there's a cultural impact. Sexism, like I was just talking about with the genders, if a male comes forward, people are like, what do you mean men can't get raped? And it's just all these different components that impact it. And when it comes to helping professionals, especially counselors, a lot of people that have experienced trauma and also sexual trauma can be misdiagnosed with, mental health disorders, bipolar, a personality disorder. Maybe they have a pre-existing diagnosis. People that abuse substances and have mental illness are at higher risk of, being sexually assaulted. So they might overlook the trauma component. And, it's important to learn about trauma-informed care. Like I said in the beginning, apply it to everybody, because, it could be underneath. It could be something that we're missing. So just some myths, the primary motive for sexual assault is sex. It's not. It's about power and control. Most sexual assaults are actually committed by somebody that the victim knows. So, it's about 80%. So stranger rapes are actually pretty rare. It could be a dating partner, a friend, acquaintance, family member. Most people know their assailant. It is not easy to identify a rapist. Like I said, these numbers are so high that, anyone could be doing it. It might not be the person that we expect. So it doesn't matter what a person does, what they wear, how they act. Nobody is asking for it. Just because they went to a certain place or did a certain thing, doesn't mean that they wanted it. They asking for that. So if a victim does not scream or fight back, it's not sexual assault. Totally wrong. In fact, most people that experience sexual violence do not fight back, might not even, react at all. They may freeze. And I'll talk a little bit about the neurobiology when we get to that. But, most people don't fight back, and sometimes they can't even fight back. Just because a woman agrees to some degree of intimacy, she wants to have sexual intercourse. So, with that, just because you consent to one thing, it doesn't mean you're consenting to everything else. We know that it's common logic. But, sometimes people think like, well, she was kissing him. So, was it even rape? And, that's why I love to educate young people, because, they need to know, especially if they've experienced this, that just because they, entered into some sort of sexual contact and the other person went further than they wanted, doesn't mean that they consented to that. And this is a big one, women lie about being raped. I get a lot of questions about this, especially from the high school students. What if somebody falsely reported? And the number of people who falsely report is really low. They estimate about like 2 to 8% of sexual assault reports are false reports. And that's actually on par with the amount of false reporting of any other crime. So it's very rare that somebody makes a false report, but that's what we hear about in the media. These are the things that get blown up. This is, when somebody of, with a prominent reputation gets accused of sexual violence or sexual harassment, the woman gets blamed. Why didn't she come forward sooner? She just wants money. She just wants attention, for whatever reason. And, it's highly unlikely that that's the case. A lot of people don't ever come forward. Sometimes people come forward years later. It's very hard to come forward after somebody has been, experienced sexual violence. So love talking to you guys about this, because you work with college students and they are one of the most high-risk populations. Other high-risk populations, adolescents and children, especially with younger children, they might not understand what's going on, easily coerced into doing things. People who are disabled, who have severe developmental disabilities and can't understand consent. Sometimes even people with physical disabilities that are not able to fight back. Psychiatric patients, anyone in facilities like this are at a high risk of sexual abuse. Elderly people, we might not necessarily think about that, but, the elderly population is also high risk. People in rural areas, they don't have access to services. They're separated, from the population. So, it's harder for them to seek help. People who don't speak English, and especially people who have, immigration issues, maybe they're undocumented and somebody assaults them and they are worried about coming forward because they are, don't want to get deported or don't want any sort of legal consequences. Perhaps the person that's abusing them is, holding on to their documents and or trafficking them for whatever reason. So, they're at a very high risk as well. So consent, basic overview, it's a choice, it's active, it's actively saying yes. When I teach kids about this, I always say, yes means yes. Just because a person does not say no doesn't mean they're saying yes. We want to get a active, confirmation that a person is consenting. Just because a person gives into fear or pressure doesn't mean that they've consented. And also, like I talked about earlier, if somebody's intoxicated, if they are unconscious, if they are sleeping, they're not able to give consent. And what I say is about possible only when there's equal power. This pertains mostly to youth under 18, but also in institutional settings. So, if you're under the age of 18, even within the legal ages of consent, because 16 in New Jersey is the age of consent. So technically a 16-year-old can consent to sexual activity with someone who is 65 if they wanted to. It's not against the law. But if a person's under 18 and the other person has a position of authority over them, then legally they can't consent. So it can't be, a boss, it can't be a teacher, a parent or a caregiver, a coach, anyone that has a position of power over them, they're not able to consent. I know that they had a situation recently in my town where the employer had sex with someone that was 17 years old, and now legal trouble because that person was in a position of power over them. In an institutional setting, this would be like if somebody is in prison or jail, like I mentioned before with the mental institution, and the other person is a worker, a guard, or someone that has power over them.
Marilyn, I just want to interrupt you just for a second. We have a question. What about an
Sure.
older sibling?
What do you mean by that?
Cheryl?
Yeah, just
In other words, like, what about, you said if they have a position of power, such as a parent, what about an older sibling who is also under 18? Is that considered a position of power over a younger sibling if there's sexual assault or contact?
so that wouldn't be considered a position of power. That is obviously an abusive situation, and that would get looked at differently depending on the age of the children. When it comes to the ages of consent, if somebody is 12 or younger, they're not able to consent to any form of sexual activity. That would get reported. We're mandated to report to DCP&P, and they would handle it. This does happen in families, and it's unfortunate. And the older sibling could definitely get in trouble, but that's not one of those situations where they're in a position of power. If it's two closely aged siblings that are 13 or over and consenting to doing it, that's not against the law. But obviously if one assaults the other or abuses the other, especially if that the one sibling is much younger, then absolutely that they're not able to give consent. So does that answer the question?
Yes, thank you.
Okay. I mean, if it was an other relative, probably a sibling over 18 might, be a big issue, or an uncle, aunt, anything like that. Obviously these things do happen in families, and it's incredibly unfortunate. But yeah, no, there's a lot of situations where, children are not possible to, it's not possible for them to give consent. So, and I'll just briefly talk about the ages. I don't think I have a slide on it because, this is mostly about the college age population, but the age of consent in New Jersey is 16, with the exception of the position of power over them. Actually, within a school context, they've raised that age to 21. So if somebody is, even if they're 18 years old and they're still in, like high school, we have kids that are disabled, they're still in high school to maybe age 21. They can't consent to sexual activity with a teacher or school staff. And that's actually a rather new law in the state of New Jersey, but it's definitely created to protect children or students that are disabled. So the age of consent is 16. If a child is between the ages of 13 and 15, they're able to consent to sexual activity with someone that is no more than 4 years older than them. So I know that in other states, they call that a Romeo and Juliet law. Some states have that, a lot don't. These ages of consent laws are just pertain to the state of New Jersey. And then I know I mentioned 12 and under, absolutely not able to give consent, and that needs to be reported to DCP&P. Depending on the situation, it may not escalate to law enforcement. If it's, say, 2 12-year-olds, they'll look at each situation individually. Any questions on that before I move on from consent?
I just wanted to add DCP&P was formerly known as DIFUS. I don't know if everyone
Yes.
is aware of that.
Yeah, Child Protective Services, DIFUS is still commonly used. So I just want to briefly talk about trauma. I'm not going to go too far into it, but these are things that happen within our bodies while we're going through any traumatic event. So, the most primal feelings are shock, fear, terror, immobility. So sometimes people, like I mentioned before, they will freeze. They're not able to move. And this is because of all the things that are going on in their body. Hormones are being released. So cortisol, our stress hormone, adrenaline, this drives our fear, and, oxytocin. So this is actually one of those ones that can be confusing to people because, this, we think about it, this is the bonding hormone. This is what happens when people cuddle. This is what's released when a mother breastfeeds a child. So this is a bonding hormone, and our brains release this to protect us from pain. And this can cause, different things during the situation. Maybe they feel physical arousal or enjoyment. Maybe they bond with their abuser. And this causes the person who's being victimized to be confused about the situation. But that doesn't mean they're not experiencing trauma. It means that, this is a chemical their brain is releasing, and it's causing these emotions that are, a little weird, a little funny, don't really fit the situation. Other things happening in the body, the blood pressure increases, heart rates, they can feel nausea, vomiting, physical shock. They could be extra sensitive to stimuli, or the hormones can actually blunt the feelings of pain. A lot of people dissociate during this situation, out of body experiences don't, sometimes they will recall it as seeing it happening to them as they're not even in their body. So all these different things are happening within our bodies during the traumatic event. And this is what causes, the next part, the reactions that come afterwards. So 3 things I like to talk about in terms of sexual violence are acute stress disorder, PTSD, and rape trauma syndrome. So most people that have experienced a traumatic event do not go on to experience PTSD. We hear about that a lot. It's definitely something that is common, but most people don't experience it. However, most people do experience acute stress after the incident. And these symptoms will mimic the symptoms of PTSD. So they could be anxiety, avoidance, avoiding a situation, dissociation, sleep disturbances. Maybe it's insomnia. Maybe they're having nightmares. They could be having flashbacks. So these are things that we associate with having post-traumatic stress disorder, but these are short-term effects. Very common. Most people that experience this will recover within 30 days. If these continue after the 30 days, this is what could, lead to a diagnosis of PTSD. So now post-traumatic stress disorder is the long-term aftermath. It is something that could last for a couple months, or it could be affecting somebody many years after the traumatic event. So the criteria for that, and I know we talked a little bit about it before we got into all this, about how, witnessing, experiencing any sort of traumatic event, it could be threat of death, serious injury, threat to physical integrity, which is what, sexual violence falls under. But we're even talking about, the COVID, the pandemic, going through the experience of, it could be, family getting sick or dying. It could be the fear of getting sick or dying that, this is a traumatic thing, especially for our children right now. So the symptoms of PTSD, like I said, if they have experienced this and now they're having symptoms, these could be flashbacks, numbing, so feeling very numb to the event, flat affect. They could be hypervigilant, so very jumpy. Maybe the littlest thing will make them on edge or get really scared. Avoidance, so it could be avoiding a place, it could be avoiding a person, for whatever reason. Interpersonal issues. So sometimes people, maybe they are isolating themselves from others. Maybe they are, having fights with their loved ones. It's affecting their interpersonal relationships. And also they are prone to having substance abuse issues. So maybe they are looking for ways to cope with the act of violence, and now they're using substances to do that. So if the person has both those criteria, that would be a diagnosis of PTSD. And rape trauma syndrome, this is not an official diagnosis in the DSM. It is something that is still used in law enforcement and court to describe, the symptoms that people experience after sexual assault. And even though it's not a formal diagnosis, it's important to talk about, because all these things, I work with people who have experienced sexual violence, and all these things that I'm going to talk about are things that, these people are experiencing, that symptoms that they're projecting. So 3 different phases that they describe in rape trauma syndrome are the acute phase, outward adjustment, and the resolution phase. And the acute phase, that's what happens right after the assault. So it could be in the moments immediately after, it could be, days or weeks, but this is when everything is still swirling around, very emotionally charged, confusion. Like I was talking about briefly with, the hormones that are released, they impair our thinking and our memory. So when a person is going through a traumatic event, their memory storage is all messed up. I always like to try to explain to people, it's like writing what's happening down on a bunch of Post-it notes instead of like taking notes on it. And now these Post-it notes are all over the place. So people they're confused. They're not sure what happened. They maybe they're getting things out of order. They don't understand the timeline. Maybe there's a big gap in what happened, or maybe they, remember one thing, but not other things. So it's important in these situations to be careful about how we interact with people, because sometimes, these questions that we ask them could be confusing or make them feel like they're being blamed for what happened. So, sometimes if we ask them like, well, when did this happen? They might not know, they might be confused. Or if we ask them why, not only may they be confused, but they also might feel like they were at fault for what happened. Maybe they had some part in this. Well, I don't know why, I don't know why I went there. I don't know, why I did this. So we got to be careful, in these situations, especially when a person is very, acute, the way that we work with them, the way that we, try to get information. A lot of this, it's very important that law enforcement is aware of this and deals with it sensitively, because they tend to be more investigative. In our normal lives, when we would deal with a person that's experienced this, I feel like, as helping professionals, educators, we would be more supportive. But, it's important that law enforcement knows, when they're interviewing the victims, that this is something that needs to be, looked at and taken into consideration. So varied reactions: expressed, controlled, and shocked disbelief. So expressed, very emotional. They could be crying, yelling all over the place. Controlled, very flat affect, minimizing what happened to them. And shocked disbelief is when somebody's very disoriented, very poor memory recall. They just might seem out of it. They might seem very confused and disoriented. And these reactions to the assault might not seem to fit someone who has just been sexually assaulted. So maybe someone's really calm and they're not reacting emotionally. And it's like, well, you were just assaulted. Like, you don't look like anything's the matter. Or maybe they're laughing or giggling. Like I said, all these chemicals are being released and it causes these reactions that might not fit with the situation. So it's important to, recognize this. A lot of things that, survivors do to minimize, it was just a rape, probably my fault. They blame themselves. Well, he didn't mean it. They didn't mean to do that. Or maybe they are, I can't live like this. This is the worst thing that's ever happened to me. I'm damaged. I need to get over this quickly. A lot of people, when they come into treatment, they have this timeline in their head of when they should be recovered by. And, the reality is everyone has their own timeline of healing. And, just because it was 3 years ago doesn't mean you should be over it. And, a lot of people will also try to ignore it. If I don't think about this, this is going to go away. So after the acute phase, the outward adjustment phase, they try to resume normal life, but this is when some more negative symptoms and behaviors emerge. And coping techniques, minimization, dramatization, making a big deal out of everything, suppression, like I said, ignoring it or minimizing it, to the point where like, this didn't happen, it's no big deal, I'm just not going to think about this. A lot of people, the explanation, they try to intellectualize what happened to them, or maybe look at things from the point of view of their abuser. Like, well, this happened because of X, Y, and Z, and that's their way of coping with it. Or flight. And flight is not just, running away from the situation. It could also be escape by means of using drugs or alcohol. So different symptoms and behaviors include, there's physical ones. So eating difficulties. It could be loss of appetite, nausea, an eating disorder, psychosomatic pain, sleeping difficulties. So insomnia, nightmares, sexual dysfunction, maybe they are not able to perform sexually. Chronic pain, like I said, it might be psychosomatic. It might refer to other areas of the body. Difficulty concentrating. Behavioral issues, they might withdraw socially, so they might stop hanging out with friends, they might stop going out to parties, avoiding certain people, or also, they might become very promiscuous and engage in risky sexual behavior. So lots of different ways that people can act out, and this is just part of how they're dealing with the trauma. Lots of different emotional issues can emerge, anxiety and depression, mood swings. Guilt and shame is a big one. It's so important to talk about that when it comes to sexual violence, because I think it's something that's pretty unique to sexual trauma, as far as, blaming themselves, feeling dirty, feeling guilty about what happened. Well, I should have stopped it. I should have fought back. Fears, phobias, flashbacks, anger and rage. They might be really angry. They don't know how to cope with that. Denial, hypervigilance, being very jumpy, feeling helpless, feeling like they're unable to help themselves, either get better or, help themselves in fearful situations. And, the anger could be pointed in all directions. They could be angry at the system, for failing them. Loss of control. They could be angry at the school. Sometimes schools do mishandle these situations. A lot of schools, and Morris County is great. You guys got a great task force in terms of, how to handle the situation. But, sometimes people, they'll try to sweep it under the rug. They could be angry at their support systems, friends, peers, their family, people who don't understand being assaulted, maybe like the people that blame victims, or, people that say things that are critical about survivors. And then obviously anger at the person who, assaulted or abused them. The resolution phase, this is when the symptoms start to subside and get a little better. Guilt and shame gets resolved. They don't blame themselves. They can acknowledge what happened to them, but now it's, it's part of them. It's part of who they are, but it doesn't dominate their life. It's not their identity. And, they're able to move on from it. They're able to gain strength. They call that like post-traumatic strength. And an important thing in this situation, when someone has been assaulted, is for them to get counseling. It helps to get counseling as soon as possible, because that'll help them avoid some of these negative, symptoms and effects. But we also don't want to pressure people into getting help. And that's part of the whole trauma-informed care model. We want them to have their power back. We want to give them choices and resources. But it's important for them to know, the sooner that they get help, the better. So just a little knowledge check. Trauma survivors with PTSD or rape trauma syndrome are either one, twice as likely to attempt suicide than the general population, two, 6 times more likely, or three, 10 times more likely. Any guesses? See, two,
one.
one.
3, 3, 1, 2.
All right, so the answer is actually two. So they're 6 times more likely than the general population to attempt or complete suicide. That's more than any other disorder. And you know, when it says here about checking out the ACE, I don't know if you guys have had trainings or know about adverse childhood event study. You know, people with higher ACE scores, which means they've experienced more traumatic things in childhood, have less protective factors. So they're at higher risk for, you know, suicide and other negative effects. So the college age student, you know, it's a different experience. They're adults now. They're sometimes going away and, you know, living for the first time away from their families. And they're also dealing with all sorts of pressure from society and even, you know, the college rape culture that we talk about, culture of sex, you know, being pressured into sex and hooking up. Independence, using drugs or alcohol, you know, conforming to gender roles. So, you know, for men to be aggressive and to try to get sex, women to try to, like, you know, be coy and earn it. And even the language that's used, like, this all contributes to the rape culture. A lot of pressure from peers, maybe they're doing it, you know, things now like dating apps, you know, it's very common for people to just be engaging in casual sex and hooking up. And the students get this message that, well, this is what I should be doing. Women especially, instead of, you know, the focus on telling people, hey, don't rape people, this is what consent is, get it? There's a lot of focus on, like, well, how do we reduce our risks? You know, don't drink anything that you've sat down or has been given to you. Go with a friend, you know, use some sort of buddy system. Don't walk alone at night. You know, we're getting these messages that, well, you need to protect yourself because obviously we can't stop people from raping. And that's not the case. I think, you know, with education about these things, you know, it's the onus is not on the person to not get raped. But these are the messages that society is still giving us. And after they've been assaulted, you know, sometimes they lack support. You know, being labeled as a date rape, you know, not all acquaintance rapes are a date. Sometimes people are not taken seriously by professionals, harassed by peers. You know, maybe there are people who are friends with the perpetrator and are now harassing the person who was victimized, or maybe the person was part of their friend group and, you know, people take their side. So, you know, for whatever reason, you know, they now are not able to get that support that they need. The campus investigation process is sometimes it's different with every school. And sometimes this can fail people. You know, sometimes I had a very close friend who, you know, was in medical school and went through this whole reporting process, was, you know, sexually assaulted while intoxicated, and not like it makes any difference, but she is a lesbian. So she was assaulted by a man. So, you know, really was not a situation where she was like wanting it in any way, and went through the whole process. Like, I had to write a reference for her, you know, so she looked good during this campus investigation, and nothing ever happened. And she wound up dropping out of medical school because now she's sitting in class every day. You know, it's a small school, and she's now seeing her assailant in campus and sitting in class with him. And these are real issues that students face, you know, like even going through the whole process, which is hard enough, for nothing to ever happen. they might be worried about consequences. You know, like I said, there could be peer pressure, harassment, or it could be, you know, maybe the person has some sort of power over them. Maybe it's a professor, maybe there's, you know, some other thing, maybe they've been threatened. For whatever the reason is, they might be afraid of consequences. And then, of course, you know, all the negative effects that happen after an assault. One thing that's important for, you know, especially college staff to know is, you know, when during a freshman year, a person is at huge increased risk of sexual violence. And I know they call it the red zone, the period of time between the beginning of the fall semester and Thanksgiving break are the absolute highest risk of sexual violence being perpetrated on college campuses. And there's lots of different reasons. You know, it could be that they're in a new environment, they're not familiar with things, they lack a support system, you know, peers that they don't know, fewer protective factors, or perhaps they're being targeted because they are new and they are vulnerable. So during this period of time, they're at an increased risk of being assaulted. And, you know, and this will go into what we're going to talk about next, which is, you know, what to look for. But women who are sexually assaulted during their first semester of college tended to have lower GPAs than women who were not sexually assaulted. So this impacts their focus. This impacts their grades. I like this quote. It says, I come into school with a full academic scholarship, and after the assault, my GPA had dropped down to a 1.0. Luckily, I appealed and got the scholarship back. But even now, about to graduate in May, my GPA isn't even a 3.0. So I'm like trying to dig my way out of that hole from freshman year. So, you know, their grades suffer, you know, their studies suffer. They may have been, you know, 4.0 student, you know, completely focused on their studies, and now they can no longer focus and their grades are slipping. So some warning signs, you know, and sometimes it is, especially, you know, working with a community college, students are commuters, they don't live there. But, you know, you may have students that you see on a regular basis, or you might notice these signs of a person in class. Maybe you're a counselor or work with them in other ways. But these are some warning signs that, you know, they might be in trouble. They may have experienced something that was traumatic. So it could be, anxiety, low self-esteem, signs of depression. So, you know, sadness, lack of energy, any sort of changes in appetite or social withdrawal. And this happens to a lot of people. This doesn't mean someone has experienced trauma, but these are some of the things that present after trauma. Any sort of self-harming behaviors, thoughts of suicide or suicidal behaviors, huge red flags. You know, obviously we want to help that person. Sexually transmitted infections. So sometimes, you know, maybe you're a medical professional and someone comes and they feel really upset about something, and it turns out they have an STI, and you know, you might wonder, like, well, you know, what did something happen to this person? They could be overly anxious about things that normally wouldn't cause them anxiety, avoidance of specific situations and places, like I was talking about, you know, failing grades or just sudden withdrawal from classes. And also, you know, increased substance use. So maybe their drug or alcohol use has increased, or maybe they didn't use substances before, and now they're starting to use them to cope. Other things, and a lot of these too can apply to people who are in an abusive relationship, because a lot of sexual violence occurs within the context of an abusive relationship. But maybe the person is withdrawing from activities or not spending time with their friends anymore. Maybe they were playing sports and now all of a sudden they've dropped out with no reason, or dropped out of a class. Perhaps, you know, the other person is trying to control them. So, you know, they're telling them not to do these things and maybe they want to. So they're kind of weird about, well, why they can't do it anymore or why they can't hang out. One red flag, and you know, you might not encounter this directly, but it's possible someone may disclose, if someone is trying to limit their use of contraceptives, so maybe not refusing to use condoms, telling them not to use birth control or tampering with their birth control. This is something that abusive partners do. A partner that's pressuring them to do things that make them uncomfortable, huge red flags. They might be controlling their means of communication. So, looking at their phones, emails, demanding passwords, social media accounts, intruding on private conversations. And then there are the very visible signs that we might see, you can even possibly see this in a Zoom class, but, visible signs of abuse. It could be bruises, black eyes, wounds, looking very, disheveled. So, these are things to look for if you notice this in another person, that, they might be experiencing abuse within a relationship. So what do we do? So if we think that someone is in trouble, and we try to help them, and now they disclose to us that something happened, very important that we validate their experience. I'm here to support you. I'm so sorry that happened to you. That never should have happened. You're not at fault. Things that we can say to make them feel like they are safe, things that make them feel heard and believed. And even if the story sounds a little funny to you, like I talked about before, their emotions might not match what happened to them. And that's normal. So just be mindful of that. Like if someone's telling you something and you're like, that sounds a little weird, the way they told me that, or the timeline, still believe them and still validate them, and know that, this could be a part of the trauma. Let them know what the resources are and help them decide to get help, but don't pressure them to do it. Very important that we give them their power back, let them make all the choices, but let them know, it's important to get help as soon as possible. These are the places that you can go. This is who you can call. This is the process. And, this is what we do to avoid re-traumatization. And I'm just going to talk about this real quick because I want to make sure we get to the reporting process. But, re-traumatization is something that reminds them of the traumatic event, and then they experience more trauma. So that's why we use a trauma-informed, approach, because we don't want to re-traumatize them. Different things, could be a situation. It could be, loss of power or control. It could be a person's attitude. It could be just an environment that was like the environment of their own, where their own trauma happened. I had a client who, she was molested by her father when she was a child, and she remembers a burgundy rug. And she would tell me, I have this burgundy rug in my home now, and that was like a triggering thing. So different things from the environment that they remember can be triggering. And if someone's re-traumatized, they're less likely to seek help, less likely to trust service providers, higher likelihood of developing PTSD, higher likelihood of suicidality, intrusive thoughts and nightmares, less willing to engage in treatment. So it's important that we, have this trauma-informed approach when we deal with people, because we want them to feel safe. We want them to be able to seek help. Like I said, establishing safety and trust, provide them opportunities to make choices and give them their power back. They must consent to receiving treatment or services. So, not pressuring them into making a police report or getting an exam. Ask them permission. Is it okay that I do this? Sometimes you might want to comfort someone and you might, put your hand on their shoulder, but ask them permission before touching them, because sometimes touch that is meant to comfort someone can be re-traumatizing.
Marilyn, I just have a quick question for you. So I know our office refers to you all the time. And as you said earlier, it's very prevalent. So when we work with people, and we meaning everyone at CCM, we need to be in the mindset that there's a good possibility that this person may have been traumatized. In your vast professional experience, how does that translate into the classroom? And what are some things that the professors on this call can utilize so that they don't re-traumatize? And you may be getting to this in a few, but I just figured since we came up with re-traumatization, I'd bring it up.
I mean, I think in terms of that, if you're concerned about a student, say they don't disclose, if you're concerned about a student, taking some time to take them aside to speak to them and, just say, I'm concerned, your grades are falling, if there's anything that's going on, some people obviously are not going to disclose, but, sometimes things like that do prompt a disclosure. Sometimes even, me doing presentations like this has prompted people to disclose to me. And it is something that, if that happens, we don't want to pressure a disclosure out of someone, but if that disclosure happens, just reacting in, the ways that I talked about, like trying to make them feel safe, trying to make them feel heard, like, I'm so sorry that happened to you. These are the resources available. What do you want to do? Is there something I can do to help you? Just approaching them in that way, very open, non-judgmental, try not to appear shocked, try not to get overly emotional. Oh, well, we need to call the cops. I can't, just try to maintain calm, establish safety for them, let them know what the resources are. And also, completely aside from that, in a classroom setting, just as, teaching, a whole classroom, like not worried about somebody that has experienced trauma, just pretend everybody has experienced some form of trauma and interact with everybody like that. Because, it doesn't necessarily just pertain to sexual trauma. It doesn't necessarily pertain to something that happened recently. They could have a history of childhood trauma. So just using that in all areas of, our lives is helpful because, we want people to feel safe. We want them to feel heard. And we want them, especially as like educators and helping professionals, to know that they're not alone and that we're here to support them if they need it. So I think too, one of the things that I do, and obviously I present on this topic, so it's a little bit more sensitive, but I always, if I'm talking about something that's a little triggering, especially like abuse, sexual violence, things like that, I give warnings. So I don't know, it depends on, what you're teaching about, but if you feel like there's anything that could be potentially triggering to someone who has experienced trauma or abuse, to give some sort of warning to allow them to excuse themselves if they feel uncomfortable, learning about a certain thing. So, I mean, like I said, as an educator, you might not be dealing with this directly, but just taking it from the lens of, everyone could have experienced trauma. So, I should interact with everyone in this manner.
Thank you, Marilyn. And, we said right before this presentation that this can be applicable to any type of trauma, especially with what's happening with the pandemic. So I think everything you just mentioned is something can be transferable into the classroom for anyone who seems to be having a difficult time. We do have a question, and I think this is more toward me and what we do at CCM, but we are required to support the disclosure if a student comes to us, correct? So should we let them know we have to report it? Do you want me to take that, Marilyn?
Yeah, because every school is different. So I don't know what your procedures are.
So thank you for this question. So you would have to report that something happened as part of the Clery Act. You will not have to give the person's name. So you can say that it's going to be anonymous and confidential, and you do not have to, and you should not report it to police or to anyone outside of the institution. You can refer them to our office. For those of you who don't know me, I'm Ariella Panic, from the coordinator of counseling and student success. And then we would work with them and we would figure out what resources they want to utilize. Does that answer your question?
Yes, thanks so much.
Oh, no problem. Okay, thank you for your question. Thanks, Marilyn.
That's great to know because, in a situation like that, you can inform the person that what they're telling you is confidential. So even though if you have to report it, you're not going to use their name. And that's awesome because maybe they don't necessarily want it getting out there. So just letting them know that, it's confidential could be reassuring to them.
Now, if it's on campus and, there's so many variables that go with it and the person was in class with someone, then there would be more steps to that. And you always want to give the student an opportunity to make sure, have a restraining order, like on campus. I don't think that's what it's called, but we could get the dean of students involved and she can make sure that the student isn't in the same classroom as the aggressor. So there's a lot of variables. If you have specific questions, I can definitely answer them. But if it happens on campus, it is a little bit different.
Awesome. So the last part I want to talk to you guys about is basically how we respond to a sexual assault. So we have what's called a sexual assault response team, and it's an interdisciplinary team that, responds to a recent act of sexual violence. So it includes forensic nurses, law enforcement, and advocates. And our organization trains and manages confidential sexual violence advocates. And I'll talk about that at the end. But a person who has had a recent assault, it must be within the past 5 days in order to activate SART. The victim must be 13 years of age or older. So a child that is 12 or younger can still get a forensic exam at the hospital, but our SART team is not activated for that. That's a separate thing. And, as far as counseling services moving forward, that's handled by child advocacy centers. In our county, it's Deirdre's House, and they're awesome. They actually do provide services as far as counseling to people who are up to age 21, so not just 12 and under. They must consent to services. And it's important for people to know in this situation that they don't need to make a report to law enforcement if they want to get a forensic exam. The forensic exam, like I said, has to happen within 5 days of the assault, not required to report to law enforcement, which is good because not everybody are ready to report to law enforcement, or they might not be ready to come forward. They might not want to. Maybe they don't want to get the person in trouble, but they still want the evidence collected just in case. And the forensic kit can be used as evidence for up to 5 years post-collection. So that's what's in the law now. I put the little stars there because our lead forensic nurse, who is amazing, just let me know that they have passed the 5-year mark at this point, and they have not destroyed any of the kits. So the hopes is that they do hold on to these kits indefinitely and not just for the 5 years. Hopefully they will change that law, and they'll be able to be used as evidence beyond the 5 years. But right now, that was how it was written. So the forensic exam, it's a long process. People might not want to go through it, but if they do, it's it's free, it's confidential. There's the same exceptions to confidentiality would apply to that, but it is otherwise something that is completely confidential and free. They would need to go to a hospital to get the forensic exam. If somebody wants it, they can go to a police station, they can go to a hospital. We have a 24-hour hotline, so they can call our hotline to receive guidance as well. It's important that people know too that there's no statute of limitations on rape. And I put the little star there because it's a little different for children under the age of 18. the laws get so muddy that I could spend forever getting into it. But as far as an adult assault, there's no statute of limitations. So just because a person didn't report right away or get a forensic exam within the 5 days doesn't mean they can never make a report to law enforcement. The sooner that they do it, the better. Obviously it's better if they collect lots of evidence and they come forward sooner. But we don't want to pressure them into making a police report. It's a really hard process to go through. It could be re-traumatizing. So it's, let them know that there's no statute of limitations. They're always able to report it. The law enforcement is supposed to be thorough and objective. Our county is great. I know they receive training on trauma-informed care and sexual violence. So, for the most part, our county's really got it together in terms of how to sensitively deal with someone who has been assaulted. But, some places aren't. So this could be a really re-traumatizing situation. They ask lots of questions. They are investigating. So they want to know those when questions, the timelines, where things happen. So it's tough for people to go through. And, part of that, why it's so tough to go through is why we have our advocates. So our advocates, not only do they answer hotline calls 24 hours a day, but if somebody is sexually assaulted and they want to go get a forensic exam and they want to go make a police report, our advocates can meet them there and support them during that process. And, they have to request an advocate. They don't necessarily always want one. Maybe they have someone there to support them anyway. Maybe they don't want a stranger in the room, so if they want an advocate, our advocates are available 24 hours a day to come meet them and to help support them through that process and to give them resources. And all communication between the victim and the advocate is considered confidential. The only time that would change is if somebody else is in the room with them. So that's just, we can tell them, as long as we're alone in the room, everything you tell us is confidential. Right now, because of COVID, we're not doing in-person accompaniments, which is unfortunate, but we're still providing it virtually. Unfortunately, not as many people are taking advantage of that service now that it's virtual, but it is still available. And the hopes is soon when, this continues to die down that we're able to go back to being in person. And, the last piece of the puzzle is counseling. So every county has a sexual violence program. I work for the Morris County Sexual Assault Center. Every program's different. They most provide counseling, they provide education and resources. All of our services are free in Morris County. So as long as the person is a Morris County resident and age 13 or over, they're able to get services through our organization. So our services, individual and group counseling. We do have support groups for survivors. We're working on creating a family group. We're trying to create an LGBT group. We do community education. So I go to schools, colleges, and professional organizations to talk about this. Like I mentioned, our advocates and our hotline. So I can send information to be distributed to you all. So you have our resources and, you can give them to someone. Hopefully you'll never need to give them to someone, but, so you'll have them available. All right. So are there any questions? I know I went through a lot, but I wanted to, make sure I covered everything. So I'm going to stop my share and I'll show everyone. So if you want to unmute and talk, or if you want to just put it in the chat, any questions about our services, anything that I went over too quickly, I'd be happy to answer. But other than that, I'm finished with the content. So
Does anyone have any questions? I have one then. Marilyn, so you work a lot with college students. I know Morris Cares works a lot with college students. What have you seen occur, when they're experiencing, as you mentioned, it could be years after the incident, it could be a couple days after an incident that someone's experiencing the effects of trauma. What have you seen can occur in a classroom? I know you mentioned, withdrawing from classes. What other signs can we look for in a sense?
I mean, since I don't really see them in a classroom, it's hard for me to say like what could present there. Like I know what I know what they tell me, and I know what presents, in my office while I'm working with them. Withdrawn, they could be in shock, they could seem really out of it. Like I said, a lot of these things might not necessarily apply just to trauma. One big thing to notice, if you notice a very sudden change in a person's demeanor or a very sudden drop in grades, that would be probably the biggest red flag that something's going on. Doesn't necessarily had to have been sexual violence, but something happened, something happened to create that change in them. So I would just say look for any major changes. And the other signs that I mentioned, withdrawing, grades falling, any sort of like weird looking physical injuries, that might be concerning. I know in my situation where I go in to talk to classes, because of the subject matter that I talk about, I can sometimes see like people's faces change when I mention a certain thing. And that, brings up something in me. I'm like, I think they've experienced that, that touched some sort of chord in them. So, if you're ever talking about anything sensitive, like everyone teaches about different things, and someone you see like a reaction in someone, that might mean that they've experienced something like that, or that they're struggling with that. I saw a comment. I can definitely send out the PowerPoint to you guys. So if I went over anything too quick, you can definitely reference that. But did that answer your question about the classroom?
Yeah, that was great. Thank you. Before we end up, we still have some more time for questions. I'm going to stay back for a couple minutes. Marilyn, can you stay back for a couple minutes in case anyone has questions? I'm going to stop recording in a second. I want to thank everyone for coming today. I want to let you know that we're trying to have more and more sessions like this. So on April 9th, we are having the Mental Health Association come in and talk about
Awesome.
how to support students, not only through COVID, but what those warning signs are, especially through virtual platforms. And we are also having them come in on, and that's at 3:30 p.m. You will be getting an email about that from CTL and from our office, the counseling office. And then on the 23rd at 3:30 p.m., both Fridays, they'll be talking about self-care and mindfulness, because, we're really concerned about students, which is super important, but we also need to be mindful about ourselves, because the pandemic and stress can impact us as well. All right, so if no one has any questions, we'll hold back for a little bit. Wait, I see some chat. Okay. And also, please email me if you are interested in the PowerPoint. I tried to get everyone's name down, but please do email me at apanek, PANEK, at ccm.edu, and we will post it. And I believe CTL will post it as well. And I'll put it in the chat for you.
I just saw a question in the chat that I want to address. It's from John. It says, this is about the LGBT group, and we're hoping to start that in April, but it says, are there any additional support systems that CCM faculty and staff can offer the LGBTQ community to feel safe and welcomed at our campus? I think as far as making them feel safe and welcome, just being open-minded, be mindful of, using gendered speech when talking about certain things, or, traditional gender norms, just being inclusive. I can give you guys information about an organization called EDGE that works with not only our county, but other counties, and they have groups for people, general LGBT groups, groups for people who are transgender, groups for parents, groups for teens. they're a great resource. If you wanted, they could come in and do a training on your campus. So just so you know, they're a wonderful resource. They've come and done trainings for us. And like I said, they have the support available. And it's not just groups, they also have individual counseling for people as well. So they're a great resource. But other than providing resources, just being open and accepting and, mindful of the things that we say.
And we also offer an LGBTQ plus support group every other week also, John. And for Sexual Assault Awareness Month, we have a bunch of events coming up. And we do have a lot of flyers about how it impacts the LGBTQ plus population as well, because it's really important that everyone feels safe and understands. Marilyn, I would love to get those resources as well, and I can disseminate them. We also have them on our website also.
No problem. Thank you so much, everyone.